Thank you for joining today's webinar. It's titled Evaluation Planning and Implementation. My name is Tanha Patel. I'm a Senior Technical Advisor with the CDC Foundation, and I'm here with a couple of my other colleagues who are also helping with the webinar today. We have Joy Henry and Haley Case running the slides and the Q&A feature for us in the background. And I really wanted to just kick off and get us going. Today's webinar is focused on planning evaluations that can be implemented by Perinatal Quality Collaboratives, PQCs. And I just want to start with the few logistics and give a chance for those who are still joining to hop on, but try to minimize your distractions as much as possible. And feel free to ask questions as they come up during the webinar. You can use the Q&A feature of the Zoom. And Haley's going to try and answer the questions as they come up, but if she can't answer them, she's going to flag them for us, and I'll pause at a good stopping point to answer those questions. We also have time allocated for questions towards the end, but in case we are running over time, we are happy to stay over and answer any of those questions that you have. So feel free to stay longer if you need to stay longer and ask your questions. We will share the slides and the recording of this webinar on our website, so feel free to just pay attention and look for the recording and the copy of the slides in the next week or so on the website. Haley's going to put the link in the chat for you all, so you can save that for later. So really getting started, let me just do a quick refresher on what is evaluation. Evaluation is an iterative, data-driven process to collect data, to answer questions you have, to drive quality improvement for your initiatives. A planned and purposeful evaluation helps inform decisions and provides a better understanding of what is expected of your initiatives and demonstrate if and to what extent the initiatives are functioning as intended. Not all evaluations and evaluation questions are appropriate or feasible. There are several factors that must be taken into consideration to decide what you should evaluate and when you should evaluate that. You should consider the need for a particular evaluation first. What information is going to be useful for your partners? What is the context in which the initiative is implemented or is being planned? And you also have to think about the resources that are available to you and whether the resources you have is going to allow the evaluation to be feasible. So let's walk through one example and we'll show you what we mean by considering these factors. Let's say we have a PQC that has three main areas that they're prioritizing over the next few years. And these are based on their community needs. This particular PQC, which we have made up for this webinar, is focused on reducing hypertension, substance use disorder, and obstructed hemorrhage among pregnant people. Each area has multiple components supporting their goals. While you may be interested in evaluating each of these initiatives and all of the activities, it's not realistic to evaluate everything, and let alone evaluate everything at the same time. So you really have to prioritize evaluating one of these initiatives and their activities. But the question really is, how do you choose what to prioritize? So to prioritize what exactly to evaluate, you will probably want to ask yourself, what's the need of the evaluation at this point for this initiative? What information do partners need, or what information are partners asking? What is the context around this initiative that should be considered, and what resources are available to conduct the evaluation? For illustration purposes, let's walk through this together and see what this may look like for the three initiatives that this example PQC is prioritizing. So let's start with the hypertension in pregnancy initiative. This initiative was launched about 6 months ago. It has 4 individuals supporting the initiative and already has a strong data collection and management plan in place. Your leadership wants to know how this initiative is going because there is a lot of attention around reducing preeclampsia within the hospital patients. And if this initiative is working and showing promise, they would like to scale it up and provide additional funding. The SUD initiative has been in place for a year now. There is a lot of stigma associated with substance use in the community, and there are not many organizations who are providing resources that are needed by the patients. So the staff have really wanted to know if the patients are following up with the substance use referrals that are made, and what challenges are they facing as they go to complete that referral. However, 2 of the 3 staff members supporting this initiative have recently transitioned out of their positions, and there are limited resources available. The 3rd initiative, the obstructive hemorrhage initiative, on the other hand, has been in place for 5 years. It's been in place the longest for this PQC. This initiative is implemented across all hospitals in the area now. And partners want, and they actually are getting regular updates on hemorrhage cases in their hospitals because there is a full-time evaluator already built in and dedicated for this initiative. The evaluator put in place a comprehensive evaluation process, so there are no immediate evaluation needs right now. So given this information, we would like you to complete a quick poll that Haley's going to launch and share which of these 3 initiatives would you prioritize for evaluation right now. And we'll talk through your answers. There is no right or wrong answer, so feel free to pick an initiative that you think fits best. And if I'm looking on the other screen, that's because the poll results are over there, so I'm not ignoring you guys, I promise. I see responses coming in. Give it 1 more minute. Yes, the slides and recording will be available to you guys as soon as we can turn those around, probably within a week or so. Let's see. Okay, I can stop the poll now and sharing the results. It seems like majority of you are saying that the hypertension initiative is the one that should be prioritized, and that is correct. The hypertension initiative is fairly new. There is a lot of attention on hypertension. The leadership is already bought in and they really want to know how well it's going. And if it is working, then they are ready to put more funding and resources in it, right? So I think that's a good place to start. The last initiative around obstructive hemorrhage is already been in place. They have strong evaluation already. So yes, there is an evaluator in place, but it may not be the priority right now. And the SUD one has a lot of staff turnover, limited resources. So although it may be important to look at, we're not ready to take that on right now with limited resources. So as we move through the webinar today, what I'm going to do is I'm going to follow along this example PQC, and then we're also going to follow along the hypertension in pregnancy initiative and really build out an evaluation plan for that initiative. So just keep following this example with us, and we'll see how we can evaluate that. So once you have an idea or 2 on what you want to evaluate, you probably are wondering, what now? How do I go about doing the evaluation in practice? There are 4 general steps that must be completed to conduct a thorough evaluation. The first one is to define the initiative that you want to evaluate, including the need the initiative is addressing, the objectives it's trying to achieve, and the context in which it is being implemented. Then you want to specify what about the initiative will you be evaluating, and what key questions will be the focus of the evaluation. Once you have the key questions identified, you then want to collect data and evidence to answer those questions. And finally, you want to summarize the information and use the findings in practice to inform decisions, improve the initiative, or guide future actions. We'll discuss the first two steps today in detail, and then the last two steps we'll try to cover in the next set of webinars in April and May. So just follow along with us and we'll be able to answer all of the evaluation steps. Core to conducting evaluation is ensuring that you engage appropriate partners throughout the evaluation. Engaging partners can improve the quality of decision-making, and it can build trust that leads to acceptance of both positive and negative results. Also, involving partners improves the quality of your evaluation because it can ensure that the information gathered is more reliable. And at the center of every evaluation is also evaluation standards. There are 4 evaluation standards. Adhering to these ensures that the evaluation is effective and high quality. Throughout planning and implementing an evaluation, these standards should be used as guiding standards that can help you make decisions. The first standard is utility. This standard identifies what is practical and useful about conducting an evaluation. Collecting data for the sake of collecting data is not ethical, and it's important to consider who will use the information, the findings from the evaluation, and how will that results be used in practice. The second standard is feasibility. This standard is focused on making sure that the evaluation can be done given the time constraints, the limited number of resources we have, and possibly other limitations that may be in place. The third standard is proprietary standard, which guides you in assessing whether doing an evaluation will cause any harm to anyone. And finally, the final standard is accuracy, and this standard helps ensure that your evaluation methods that you use can lead to correct information. Keeping the standards in mind throughout evaluation is important, and we will come back to these standards on a regular basis. But today we'll do a particular exercise to help make a decision on which evaluation to focus on. So before you can start implementing the evaluation, you need to develop an evaluation plan. There are a lot of moving pieces to manage in an evaluation project that can become really overwhelming for a lot of team members. So the evaluation plan is highly recommended, and I believe it is also a requirement for some of the PQCs. So what is an evaluation plan? An evaluation plan is your guiding document that outlines exactly what you want to evaluate, why that particular evaluation is important, and how it will be conducted and used in practice. The plan creates a shared understanding of the evaluation purpose and the methods so that anybody can pick up the plan and understand how to do the evaluation that you're planning. Of course, with clinical and public health programs, they are very dynamic and changing often. So your evaluation plan should be continually updated to reflect any changes in the initiatives or the priorities of the initiative or the organization, or if there are staffing changes, you probably want to update the plan for that as well. Without a plan in place, trying to evaluate something would be very confusing and time-consuming. Using an evaluation plan, make sure that you use your resources effectively and that you're answering the questions that are most important to you and your partners. This slide lays out what makes up the evaluation plan. I'm just going to keep this on here for a second, but we'll walk through each of the components in more detail. Next slide, Joy. If you follow the sections of an evaluation plan, you'll have outlined your approach to accomplishing all 4 steps of doing an evaluation as shown on the slide. So if you do the background and initiative description sections, that will help you complete the first step of defining what you're evaluating. The evaluation focus section of the evaluation plan will outline the focus of your evaluation. Then your evaluation method section will outline how you plan to gather evidence and communicate and disseminate. Section of the evaluation plan will describe how you plan to summarize and use the findings in practice. Today, we'll spend most of our time discussing the evaluation background initiative descriptor, and the evaluation focus. We'll also touch on what are the minimum requirements to consider in the remaining sections, but we'll have more time to explore those topics of data collection and evaluation dissemination and use in later webinars. So thinking back to the example PQC we introduced earlier, we decided that it's going to be best for us to consider evaluating the hypertension in pregnancy initiative. This initiative consists of 2 activities. The first activity involves promoting the development and implementation of comprehensive care plans for pregnant people with hypertension. The care plans specify how hypertension will be detected and monitored. It will help identify patient risk factors, and it will outline what care steps should be taken by clinicians and by patients. The second activity involves developing a protocol to ensure patients with hypertension in pregnancy are continuing follow-up care postpartum. So let's build out an evaluation plan for this initiative together. The first section of the evaluation plan, after the title page and table of contents, is the background section. In this section, you'll describe the relevant background information on your organization. This can include, but is not limited to, the mission and vision of your PQC, the major priorities of your PQC, the influential partnerships, and anything else that is relevant for your PQC, such as your administrative structure or significant funding sources. Also, you need to describe the perinatal health need that your PQC is addressing, such as the major causes for perinatal mortality and morbidity, relevant health disparities in your area, and any perinatal health issues that are underaddressed or overlooked. Include data and any references that you can provide context for this perinatal health need. This section should be about 2 paragraphs in length, but again, depending on how much history and background your PQC has, it may be a little bit longer. This slide shows a condensed example for what the background section might look like for our example hypertension initiative. This is just a snippet of what can be included. Your particular example description for your initiative may be a little bit longer and probably has a lot more detail. I'm not going to read everything on this slide, but this section includes PQC's mission and vision statement, where it is housed, what are the priorities, and that 85% of the birthing hospitals in their area are participating in the initiatives. It also highlights the need to address hypertension in pregnancy, especially Black and American Indian and Alaska Native pregnant people. Once you have described your PQCs and its priorities, the next section of the evaluation plan describes your quality improvement initiative in 1 to 3 paragraphs. This description, you should include key details about the initiative itself. So this is the hypertension initiative that we're talking about. Especially describe the need being addressed by the initiative. Next, describe the population impacted by the activities. In particular, include how the initiative is engaging facilities that serve communities inequitably impacted by adverse perinatal outcomes. Explain how long the initiative has been in place. You also want to describe the goals and outcomes that the QI initiative expects to achieve. And finally, describe information on the activities that are being implemented as part of the initiative. In addition to describing the activities of your initiative in a narrative form in paragraphs, it may also be helpful to use a visual tool to show how the activities that you're implementing are connected to the outcomes that you're hoping to achieve and the ultimate goal of the PQC. As shown on this slide, us evaluators often use logic models to explain the intended link between the activities and the expected outcomes. This logical flow then leads to a theory of change for the initiative. While evaluators like to use logic models, we recognize that you may be using other tools to describe your activities, such as driver diagrams, and that's completely fine to use as well. We just want you to consider using some form of visual representation so that it can help describe what is happening, why it's happening, and how the goals and outcomes will be achieved by what you're planning to implement. This slide, next slide, Joy. This slide is a condensed example of what the initiative description section might look like for the hypertension initiative example. You will certainly have more information for your initiative, but for us, we just wanted to condense it down to one slide. You'll see that in our summarized example, the goal is to reduce preventable morbidity and mortality due to hypertension disorders in pregnancy in the state. The initiative currently delivers services to pregnant people in 3 rural hospitals across the state. The initiative has been in place for 6 months and will continue for 2 years in total. And the initiative involves training clinicians via webinars and resources to help them develop individual care plans for pregnant patients with hypertension, and the activity of providing case management to promote postpartum follow-up care. So again, this is a quick summary of our example. So once we've described our initiative, now we really have to focus in on what we want to evaluate. And in 1 to 2 paragraphs, we have to identify what's the purpose of this evaluation, what exactly we will be evaluating, and which evaluation questions are we going to answer. So at this point, we want to narrow down even further on what about the initiative should we evaluate. In our case example, we want to decide which component of the hypertension initiative, the care plans or the follow-up care, is going to be the best suited activity for us to evaluate right now. So let's make that decision using the 4 factors that I had mentioned earlier. So for our hypertension initiative, we know that we only have enough resources to evaluate one of the initiative components. We know that the initiative has only been in place 6 months, so it'll be hard to see any long-term outcomes of the work. So this is suggesting that we probably want to do either a formative evaluation or a process evaluation. We also know that the leadership is really interested in this initiative because effective implementation of care plans can lead to saving lives, and it can also have potential care cost savings. So this is a big priority for our leadership. And we know that understanding how well the care plan trainings are implemented is the key, because if the trainings are effective, the staff will have the knowledge and ability that they need to start implementing the care plans effectively. And it'll also be easier to scale up the trainings than the actual implementation. So this is suggesting that we should prioritize focusing on evaluation of the implementation of care plans as opposed to the follow-up care for now. So now that we know we want to focus the evaluation on the care plan training and implementation, we can start describing what exactly we will be evaluating. We can now say that we are already implementing the initiatives. So this is in an implementation phase. The purpose of our evaluation is to learn how the trainings are working and if the care plans are being implemented as planned, which means that we'll be doing a process evaluation. The evaluation findings will primarily be used by the implementers themselves, who may learn how to improve their implementation of the initiative. And the PQC leadership is also going to be using the information to make decisions around the maintenance and funding for the initiative. What we still need to decide is what are the key questions that will enter this evaluation. We'll spend the next few slides talking about evaluation questions, and then we'll jump into another polling activity to have you guys help me make some decisions. Just as a refresher, evaluation questions should be built on purpose of the evaluation. They should be informed by the need of the evaluation, whether the need is informed by your partners, your staff, or committee members. Always think about what data will be most useful. Strong evaluation questions are open-ended, asking how and to what extent, why something may be happening or why not. Evaluation questions should not be close-ended, such as yes or no questions. These can be answered easily without any context to truly understand what's happening. So for example, instead of asking, were the right participants reached, you may want to ask, who is being reached and how are they being reached? Evaluation questions that you decide on will guide the rest of the evaluation planning and implementation. So they're really your anchor for all the evaluation activities that will follow from here. So let's walk through some example questions first. Evaluation questions will vary by the type of evaluation you're doing. In this slide, we share some generic evaluation questions that can be asked for each evaluation type. If your initiative is still in the design or forming phase, you will want to ask formative questions, such as who has the need? What is the need? What type of initiative can we implement to meet this need? And how best can we implement the initiative to meet the need? If your initiative is already implemented and you want to understand how well it's going or whether it's been implemented as planned, you want to ask process-related questions. These are how and to what extent was the initiative implemented as planned? Who is being reached and how are they reached? What and how are resources utilized? And to what extent were the resources sufficient for the initiative activities? You may also ask what resources are still needed. Finally, if your initiative has been in place for a while and you feel like you should be able to start monitoring changes as a result of the initiative, you probably are leaning towards outcome-related questions. These are questions like, what were the outcomes of the initiative? Was the initiative more successful in certain contexts? Can these outcomes actually be attributed to the initiative? And what was the impact of you doing the initiative or the activity? For any type of evaluation, the evaluation question should be feasible, and they should be appropriate for the unique context of the evaluation. Answering these questions will probably take a lot of time and effort. So you want to think about how do you prioritize which questions to answer, and you probably don't want to answer every question that comes up for the initiative, right? Because that's going to take a lot of resources that we don't have. So let's do a quick activity and bring it back to our hypertension example. So I want us to do a quick activity to practice putting evaluation questions by the type of evaluation first. So we've developed a few example evaluation questions that may be appropriate for our hypertension example that we have been following so far. Haley's going to launch a poll. We have 3 questions for you. For each question, we'd like you to select which evaluation type fits the best for the proposed evaluation question. So I'm going to give you a minute or two, and then we'll come back and discuss together. Again, there is no right or wrong, so feel free to answer whatever makes sense to you. I'll give us 1 more minute. I think I see slowdown in responses, so I'll close the poll in just a second. Okay. So instead of sharing the results, what I'm going to do is I'm going to walk us through the questions themselves and kind of answer at the same time. So the first question that was asked was, how effective has the hypertension initiative been at reducing hypertension-related morbidity and mortality among pregnancy and postpartum people? This is an outcome evaluation question because it asked about if the initiative has changed the intended health outcomes. Another potential outcome evaluation question is, what is the return on investment of the initiative? We haven't discussed economic evaluation significantly yet, but return on investment will be an economic outcome of the initiative. The second question was, what type of QI initiative can we implement to meet the need to address severe hypertension in pregnancy? These are wordy questions, sorry about that. This is a formative evaluation question because it asks a question about what sort of initiative should be designed. The question isn't about an existing QI initiative, but instead it wants to know what initiative would be effective to meet the needs of the community. So it's more of a formative phase of a question. The last question was, to what extent is the hypertension care plan process working and how can it be improved? This is a process evaluation question because it explicitly asked about how the activities are working. Does this resonate with you all? Feel free to submit your questions in the Q&A feature if you have questions on this, and we'll come back to it as needed. But I want to see if there are any burning questions real quick. I don't see any, so I'm going to keep going and we'll pause later on again. For the care plan related activities in our example, some potential process evaluations questions that we can ask are, what are the barriers to adhering to care plans? What are patients' perspectives toward their care plans? To what extent are the hypertension care plan activities functioning as intended? And what recommendations do case managers have for the design of care plans? All of these questions sound good, right? But let's see if they actually meet the evaluation standards that we talked about earlier. Just a quick reminder, the evaluation standards, are utility, feasibility, proprietary, and accuracy. Let's assess these questions together against each of these standards. And Haley's going to launch another poll for us. In this poll, you will select which of the 4 evaluation questions that we are proposing meets each of the evaluation standards. So I'm going to pause again. So in this poll, we're asking you to decide if the 4 questions we proposed are able to generate usable findings. If so, which of the questions is able to do that? Which of the 4 questions seem feasible? Which of the 4 questions seem like they're ethical? And which of the 4 questions seem like they would provide you with accurate information? And you can move your poll window to the side if that helps you to see the questions. I'm seeing some responses come in, so I'll give you guys another minute. Okay. I'm gonna close it. I see one or two straddlers coming in. Okay. Again, I'm not going to share the results, but I am going to walk us through all of the questions. So thank you so much for participating in the polls today. I know it's always useful to kind of engage you guys and make sure you're following along. So thank you for participating. It does help us if you do participate. The first question we asked you was to indicate which of the questions would generate usable evaluation findings. All of the questions but question D meets the utility standard. Question D is not useful for this evaluation because the initiative is already designed and in place. It's already been in place for 6 months, so looking at the design factors is probably not going to be as useful right now for this initiative. The second question asked you which of the following questions are feasible to evaluate. Questions A and C are feasible right now because they're both focused on the activities that are happening now and can easily be answered by engaging the staff members, whether in surveys or just conversations. Question B is not feasible because we will have to engage patients that requires additional resources because we may have to do focus groups or interviews or reach out to them. And we may also have to get additional approvals to actually talk to the patients. Question D will also require direct data collection from case managers, but the question itself is not useful since the initiative is already in place, so the feasibility kind of drops with it too. The third question in the poll asked you about proprietary standard, so which questions can be answered ethically? We don't see any ethical concerns with any of these questions based on how they're written. And then finally, the fourth question asked about accuracy. Which questions can we collect accurate information from? And we envision how we would be able to collect accurate information to answer all of these questions. So I don't think we have any concerns there either. But based on this assessment, we're left with two strong evaluation questions that meet all of the evaluation standards. What are the barriers to adhering to care plans? And to what extent are the hypertension care plan activities functioning as intended? So this exercise helps us now complete focusing our evaluation piece, because now we know exactly what we want to evaluate. We want to evaluate the hypertension initiative. We want to focus in on the care plan component of that initiative. And now we have two strong process questions that we want to answer. So now that we know what we want to evaluate and which questions we want to answer, next slide, Joy, we should start thinking about how to answer these questions. The evaluation method section of the evaluation plan starts to do this for us. For the evaluation plan, in 1 to 4 paragraphs and some tables, you will propose a plan that outlines what data points and measures will help you answer the questions that we've selected, and how will you collect the information. Your evaluation plan should contain a data collection plan, which outlines how the data will be collected, who is responsible for that, what timeline are you going to use, and frequency for data collection that you're going to use. The evaluation plan should also include a data management plan, which answers questions for each data source, how data will be safely stored and released responsibly. Then finally, the evaluation plan should also include a data analysis plan, which outlines for each data source how the data will be cleaned, aggregated or disaggregated, and how you will analyze that information. These are typically displayed in table formats, but with narrative descriptions to provide more detail. Again, use your organization's guidelines on how and what requirements you have to fulfill for all of these components, but these are the minimum requirements that you should think about. Next, your evaluation plan should include a plan for how you will share the findings from your evaluation. A strong evaluation is planned and designed to be used to improve the initiative in some capacity. This is one of the main evaluation standards we talked about, right? The utility. We have to use the information that we're getting. In this section of the evaluation plan, in 1 to 2 paragraphs, you will want to describe your thinking around how evaluation findings might be used and who might use it. Also describe what action you want that person to do as a result of getting the evaluation findings. So for example, think about, is the partner that's going to get the finding going to help you find additional funding, additional resources? Are they going to help you make decisions related to the next step of the implementation? What are you asking the person to do as a result of giving them the information? And that should be described in that section as well. And then finally, the evaluation plan must have a timeline outlining when you plan to accomplish the evaluation activities. Based on what you're planning, you'll want the timeline to be as described as you can provide at the time of writing the plan. And again, remember, plan is a living document, so as timeline shifts, or if you know more information, you can come in and update the timeline. In the timeline, you can also include who's responsible for each of the steps. This way you can plan for personnel resources and make adjustments based on who's available at what time. The timeline can be displayed in a format that works best for you and your team. On this particular slide, we have a timeline of a selection of evaluation activities that can be completed for our hypertension evaluation example, but you can use tables, Gantt charts, or other formats that makes most sense for you. Once you have completed your timeline, you should have a comprehensive evaluation plan that outlines how you will complete each step of the evaluation plan. What we haven't discussed so far is that many of your evaluation plans, you're drafting it for 5 years, and you may want to focus on more than one evaluation component, right? You may want to have multiple initiatives, or you may want to look at multiple components of one initiative over time, and that's totally fine. If you want to do that, you will simply add descriptions for each initiative or the initiative component you want to evaluate, and then follow the same steps in focusing and planning the evaluation methods and communication of the findings. You will have to clarify which evaluations will be done when, and include that detail either in the description or in the complete timeline. So we can see that in year 1, you really want to focus on this, but in year 3, you want to focus on something else. So with that, I really hope that today's webinar has given you enough information to start thinking about what you want to evaluate and how either you develop an evaluation plan or refine an existing plan that's already been drafted. And remember, evaluation plan is a living document, so it's okay to update the plan, especially as the initiative activities, personnel, or the resources start shifting over time. Just a quick reminder that we'll continue talking about how to gather evidence in webinar 3 in April and how to use evaluation findings in webinar 4 in May. And for those who receive CDC funding, we are hosting office hours where you can bring up specific questions related to your evaluation plans, and we can help you kind of troubleshoot some of those questions one-to-one. The next office hour is scheduled for March 19th at 3 p.m. Eastern Time. And if you haven't registered, please do so we know how many individuals we should plan for. And Haley's going to drop the link to our website where you can find the registration and the recording of the slides and the webinar there. With that, I want to say thank you for attending today's webinar. And we have time to take questions, and even if we run out of time, we're happy to stay a little bit longer if you guys have questions that you want to catch us on. But if you do have to hop off early, the webinar ends when you click end, but there is a Zoom launch for a survey, and we really do appreciate you taking a minute to kind of fill that out for us. We'll continue to evaluate ourselves and update the webinars as we go. So with that, I'm going to stop talking and see what questions we have. So Haley, do you want to help moderate the questions for me?
Yeah, I will. And if anyone has further questions while we're talking, definitely I'll continue to monitor as they come in. So we have a few questions. One of them is about, and I'll paraphrase, but it's in the Q&A box. It's about challenges developing the evaluation plan while also having to manage things like work plans and APR narratives for, in this case, CDC funding. So is there a way you could clarify how to streamline these different deliverables or distinguish between these deliverables?
Yeah, so that's a good question. So think of your work plan as the plan for all of the activities that you're going to do over the year or the 5 years. Your evaluation plan is a plan for evaluating one or a couple of those activities that you are implementing. So the work plan is really associated to, say, using our example, we're going to focus on hypertension and substance use disorder. And within those two areas, we're going to, work with case managers to do follow-up care. We're going to implement care plans, or we're going to implement the AIM bundle. Those are your activities that you are planning to implement that should be part of the work plan. But how you evaluate one of those will go into your evaluation plan. And remember from webinar 1, and if you haven't attended webinar 1, the recording is on the website. There is a difference between monitoring the activities and evaluating the activities, right? So just knowing that you implemented the AIM bundle or you have 10 people that are trained to do care plans now is more of monitoring, and evaluation is going into a deeper dive to say how well are the care plans being implemented. Who did we engage in implementing the AIM bundle? So learning more of the context of what's working, what's not working is what is in the evaluation plan. Versus the progress report is just counting what you're doing day to day.
Great, thanks, Tanha.
Sure.
In a similar vein, we have another question from someone who received CDC funding asking if today we would be going over the table showing the alignment between your QI initiative and the NOFO strategies. So I'll let you address that.
So we're not going to go into that detail during this webinar, but we're happy to pull that out during the office hour if you're able to attend the office hour. But really think about your initiatives and how the work that you're doing within those initiatives helps you achieve the strategies and the goals that are outlined in the NOFO. So if you do that visual logical flow, the logic model example, Joy, if you wouldn't mind just scrolling back to that slide, whether you use a driver diagram or whether you use a logic model, kind of map out, if you do this activity, how does that link you to the strategy and the overall goal of the program? And just describe that in a narrative form. Keep going a few more, Joy. I think a few more. Sorry, lots of clicks. I think maybe 2 more slides before this. One more. Right there. So whatever visual format makes most sense for you to say that if we do this activity, it will take us to this outcome, or it would take us to this outcome, which helps us address this strategy in the NOFO, or it helps us address this goal of the NOFO. Ella, are you supposed to do both a logic model and a table? Can you tell me what you mean by a table? Do you think we can unmute Ella if she wants to hop on? Okay, she'll ask during office hours, but if I'm understanding correctly, the table included in the template that you guys received from CDC is an option, so you can do either or. It really is up to the PQC and what makes most sense for you guys. But you can ask your program officer as well. Oh, sorry, we'll get you in office hour.
Thanks. And one more question we had earlier, I think from Ella as well, that I addressed in the chat, but I'll bring up to address as the group, was back around the background slides. And so the question was, if one is to include references in the background section, is there a preference for in-text citations, keeping the references at the end in an appendix, that sort of thing?
Yeah, really no preference. It really depends on the organizational style. I know a lot of organizations have their own preferences for what they use, so follow your organizational style. If you don't have an organizational style, APA citation format is broadly used, and we just ask that you be consistent so the reader can really follow along and know exactly what you're doing. But no strong requirements there, just follow what makes most sense for you. Other questions? Was this helpful to you guys? We heard in the last survey that you wanted more interactions and just more examples of how this applies to you guys. So see a lot of thumbs up coming. It's good. So keep giving us feedback because we want this to be useful for you guys. Do I see a raised hand? Yeah. But we're here for a few more minutes. If you guys have questions and want to catch us, feel free to stay along. But if not, that is all we had planned for you. So please take the 5 minutes to complete the survey if you're hopping off early, but hope you have a good rest of the week.
If you're sticking around, I am able to kind of allow guests to chat. It will just take me a few seconds. So let me know if you want to unmute and I can take you off.
And if questions come up later on, please feel free to use our email address, maternalhealthtta@cdcfoundation.org, and we will monitor and get back to you on that.